Allah the most beneficial and merciful, neither he begets nor he is begotten. Today we'll be talking about the anatomy of human face, focusing on the learning objectives. Today we'll cover introduction of face, introduction to orbits and its wall, the content that are present inside the orbit, the openings in the orbit, the lacrimal gland and paranasal sinuses. Now talking about the face anatomy, the human face makes up the most interior portion of the human head. And if we talk about the anatomical borders, it runs from the superior margin of the forehead down to the chin and from one ear to another. Now, the basic shape of human face, it is determined by three things, which include the facial skeleton, the facial muscles, and the tissues present underneath. Now, just like any other body part, the face also has some roles. It plays important role in communication, expression of mood and emotion, and its shape and features provide us our external identity, which make us stand out. Now, talking about the regions of the face, the human face majorly is divided into three parts: the superior part, the middle part, and the inferior part. And it is further divided into 10 subregions, which include the frontal, the nasal, the labial, the mental, orbital, which also include our supraorbital and infraorbital region, the zygomatic, the buccal, parietomesseter, temporal, and auricular. Now talking about orbit. What is an orbit? Orbit is basically a pair of pyramidal cavity with a base and an apex. The base is directed interiorly and the apex is directed posteriorly. Now, why do we have this orbit? It is basically a cavity which contains and protects 5 by 6 of the eyeball, associated muscles, nerves, vessels, and its opening is protected by a thin movable fold which is known as eyelid, and it also supports, protects, and maximizes the function of eye. Now, talking about what makes up the orbit, there are 7 bones which play a part: the frontal bone, the zygomatic, maxilla, palatine, lacrimal, ethmoidal, and sphenoid. Now, talking about what resides inside this orbit, the orbital content includes the eyeball, extraocular muscle, which include 4 rectus muscles and 2 oblique muscles, the associated nerves which provide the intervention, the associated vessel, orbital fat, most of the lacrimal apparatus, and optic nerve. Now, talking about the very important thing here, the walls of the orbit. The orbit has got 4 walls: the lateral, the medial, the roof, and the floor. The lateral wall, it is made up of 3 bones: the zygomatic process of frontal bone, the greater wing of sphenoid bone, the orbital surface of zygomatic bone. And then we have the medial wall, it is made up of rather 4 bones: sphenoid body, the orbital plate of ethmoid bone, the frontal process of maxilla, and the lacrimal bone. The roof of the orbit, it is made up of 2 bones: the lesser wing of sphenoid bone, the orbital plate of frontal bone. And the floor, it again made up of 3 bones: the orbital process of palatine bone, the orbital surface of maxillary bone, and the zygomatic bone. Now, talking about the openings in the orbit, we have the very major one, which is known as the orbital opening. It lies rather interiorly and exposes 1/6 of the eye. The supraorbital foramen, it is located in the superior orbital margin and it transmits supraorbital nerve and vessel. Then we have infraorbital foramen, which is located in the orbital plate of maxilla. It transmits infraorbital nerve and vessel. Then we have inferior orbital fissure. It is located rather posteriorly between the maxilla and greater wing of sphenoid. It transmits inferior ophthalmic vein and sympathetic nerve. Now, talking about the superior orbital fissure, it is also located posteriorly, but between the greater and lesser wing of sphenoid. It transmits rather 4 nerves: the oculomotor, which is the 3rd cranial nerve, and specifically its anterior and posterior division, the trochlear nerve, the trigeminal, specifically its ophthalmic division and its branches, which include lacrimal nerve, nasociliary, and frontal, and then we have the abducent nerve. Then we have the optic canal. It is also located posteriorly in the lesser wing of sphenoid, and it transmits optic nerve and ophthalmic artery. Now we have a nasolacrimal canal. It is located interiorly on the medial wall and it communicates with the inferior meatus of the nose, transmit nasolacrimal duct. Then we have a very important gland which is known as the lacrimal gland. The lacrimal gland is situated above the eyeball in the anterior and upper part of the orbit, rather posteriorly, and it opens into the lateral and superior part of the conjunctiva. Here we have a clinical which is known as blocked tear duct. Here what happens is nasolacrimal duct get obstructed due to an infection, or in babies due to amniotic fluid collection, which result in excessive tearing and eye mucus drainage, and it is corrected through probing, which is also known as tear duct probing. Now I'm talking about the very last part here, the paranasal sinuses. What is a sinus? It is basically air-filled spaces in the bone lined with mucous membrane, and it present around the nose are called paranasal sinuses. We have here frontal sinus, which is located rather at the upper portion, the maxillary sinus, which is located below, and ethmoid and sphenoid sinus, which is located rather medially. Now talking about, we have here is a clinical, which is known as sinusitis. It is the inflammation of the sinuses, usually caused by an infection. It is common and it usually clear up on its own within 4 weeks, but if not, and taking a long time, you could take a help of medicine. The causes here are, it could be viral infection, bacterial infection, fungal, any allergic reaction, side effect of some medication, nasal polyps or dehydration. And if we talk about the symptoms, we have a nasal mucus, plugged nose, the facial pain, fever, and headache, which is a common symptom of any infection. That's it.